Hello and welcome back to A Modern Pharmacist. Now today's episode is something that's quite close to me. It is all things exercise, and hopefully by this point you've sort of got onto the idea that I'm fully into this idea that we should be preventing conditions long before we should ever need to treat them and react to them. And that all comes from living a good lifestyle, which years ago I would probably have said diet is the most important thing. However, the more I look into the literature, research, I feel as though exercise is at the top of the list now. However, despite this, not many people are treating it with the same amount of respect that I do, whether that be in public health, healthcare professionals, schools. And that comes on to the first question before we get into this whole podcast, because this podcast will hopefully give you, if you are looking into bettering your exercise and your health, it will give you a good plan as to what to do going forward. Or if you work in healthcare or advise other people, then it's going to give you the most efficient plan for those people to get the most out of their health. But the first thing I wanted to look into was who is to blame for the lack of physical education out there. And I've got four things or topics that could be to blame. So you've got guidelines, health-related degrees, healthcare professionals, and school. So I'm going to run through them quickly and what I mean about each one. So guidelines, why are they to blame? Well, yes, if you look at the UK Chief Medical Officer's guidelines for exercise, it is there, and the advice is pretty good, to be honest, but it's not tangible and it's not in an easy to digest format, especially for those who've never been within a gym or an exercise environment. I can read them, but even then I would probably struggle to implement. Does that mean I have to do X in addition to Y, or do I have to do either or? It's not very easy to read. So the guidelines could have been made a lot more ergonomic, but also when you look at, let's say, blood pressure, and there's a new treatment that's just come out, a pharmacological treatment, that guideline will be heavily based and biased towards the pharmacological treatment. It will have a small section on lifestyle intervention, exercise, diet, but the guideline is more biased towards the treatment, which in my opinion is where the guidelines are to blame. Going on to the degrees, so I obviously done a pharmacy degree. I know this stands for doctors who do medical degrees and nurses, is that less than an hour, and I'm being well, this was according to a study done in 2012, which said that a doctor has about 4.2 hours of physical education across their full 5-year degree. Now, from my pharmacy degree, I would probably say less than 30 minutes across the 4 years that I did. And of them 30 minutes, I don't think it was anything worthwhile, to be honest. I don't think the people running the workshops were in any place to give that advice anyway. So the degree is where you should really be implementing a lot of these things. And when you are actually going through these degrees, I'm trying to think of an example of where you would go through it. But let's say type 2 diabetes, the lecture would literally go, okay, so with type 2 diabetes, it can be prevented through lifestyle, such as exercise and diet. So eat less sugar, eat a bit less fat, and move more. Now let's go into treatment. And that would literally be the advice that you're given on. And then literally it would go into metformin, glycoside, insulins, SGLT2 inhibitors, whatever it is that we were discussing. But the whole way was just tick box and then pave our way onto pharmacological treatments, because that is what's going to happen. And that's where, is that our fault as a medical profession, where we've sort of not brainwashed the public, but guided people into this idea that we're not going to really spend too much time on prevention because we're that good at treating it, then we'll just focus on the treatments. Anyway, I think the degrees need to have a lot more physical education within them. Then comes on to the professionals. Now, I see this firsthand a lot of times. I had a consultation yesterday that I reviewed after one of the GPs actually had a review of the patient. Blood cholesterol was off, so they done the classic, let's do one line which says lifestyle advice, and then the other 6-7 lines are how to dose a statin. Now, again, I don't know what lifestyle advice was given, but given the fact that it was less than a 10-minute consultation and the people that I knew who give the consultation aren't in any good physical shape whatsoever, then I don't think it's going to be that used to the patient, and they are going to be heavily reliant upon the statin, and future treatments that they will be needing to lower all their biomarkers because they haven't been given the correct resources. Now, obviously, as I've alluded to, guidelines aren't best suited for healthcare professionals, neither is the degree. However, I'm a healthcare professional. I train every single day. I went out of my way when I was 17, 18 to look into it, and I do so on a daily basis. I try and improve my physical performance. So we have something called continuing professional development, which basically a lot of people treat that as we need to know what is the new lipid management therapy, what is the new blood pressure tablet. However, that also includes for me looking at how can you improve someone's lifestyle through how to advise on fiber within the diet, how to improve their strength through gym activities. These are all things that come into that continuing professional development. So I also feel as though it is heavily reliant and the blame should go towards healthcare professionals as well. The last one are schools. Now, I think Matt does fitness, if you ever follow him. I think he's legend now on the Gladiators on BBC. But he made a good point. He used to be a PE teacher, I think, and he was saying about the fact that children within schools should be educated to a higher degree because once they leave school, there's no real compulsion to exercise, which is what happens with the majority of the public anyway. And I was just thinking from my own point of view, what is the only lesson that you could go through school, secondary school, and you could miss without there being an issue? And it was always PE. If someone forgot the trainees, they forgot certain parts of their PE kit, you could go off and play on a computer, you could go and do some homework. But if you were to do that in a maths class, English, it wouldn't be the same. You would have to sit within that lesson. When in my argument, obviously I done all the classes you need to do, done very well in my GCSEs and A levels. I use Pythagoras' theorem a lot less than what I would have done in terms of how to strength train properly. And obviously it helps me live a lot longer. So I feel as though schools need to do a lot more. But you've sort of got the idea that there's a lot of people to blame in the lack of physical education that goes on within the health system and within public health in general. And a few stats that I wanted to pull just to make people aware of how much of an issue this is within adults within the UK and the US. Now, the data doesn't really carry that well. So for the UK, it was only ever reported for England. So last year, I believe, there was over 11 million adults who were classed as inactive. Inactive within these studies were less than 30 minutes of activity each week, but some of them could have been doing zero activity, which is absolutely insane. And then when you look back at, I think it was 2020, there was a study within the USA, and 25% of US adults have zero activity. And I think only 47% were meeting the aerobic guidelines, which is 2.5 hours per week of any sort of baseline activity. So it goes to show how much of a state we are in from an exercise point of view. And I personally think it's obviously a lot of people don't like the idea of doing exercise, but once you've done exercise, you look a certain way, you perform a certain way. I feel as though it's easy to go into a cycle. It becomes addictive. Same with anything really, where you enjoy it. You obviously want to go back and keep doing it because you're getting a reward from it. And I feel I watched a man today in the gym and I was so close to intervening and I thought, I'm going to leave him because I'm literally leaving the gym. But he was walking around and you could tell he wasn't too sure on what he was doing. He was scanning the QR codes. And I feel like that's why a lot of people don't go near exercise because they don't know what to do. They know that they should go to a gym, but what do they do in the gym? How do they use their time effectively? So what I'm going to go through now is how you can efficiently improve your exercise. This is not the most optimal because optimal is a case of training every day, give or take, having structured programs, progressive overload. These all still apply here, but this is for the person who potentially isn't exercising at all or wants to get the most out of their exercise routine. And to be honest, there is a lot to encompass in here, even if it is just classed as an efficient way. So I'm going to go through it in 5 sections, but I want you to think about it as 4 main pillars of exercise, with the top bracket, if you want to call it, where it sits on all the 4 pillars, is your baseline activity. So that's what I'm going to start with. So baseline activity is what you do day to day. Everyone's probably heard of 10,000 steps. And from memory, I think it was from the 1964 Tokyo Olympics. It was a marketing scheme because they were trying to get a pedometer basically out there. And I can't think of what it means, how to say it in Japanese, but it basically stood for 10,000 steps. The evidence shows around 7 to 8,000 steps a day is a good one where it starts to plateau, essentially where the benefit starts to run away. But the whole point is, don't do what I'm doing right now, I'm doing this podcast, and don't remain sedentary for too long in a day. So ideally, you are going to get 7 to 8 hours of sleep. Straight away, you've got 16 hours left in that day. And if you are in an office job, 8 hours, 9 hours maybe, are basically you being sedentary. So then you've got anywhere around 7 hours left of the day to try and be active. And most people sit down and watch the telly, do other things. So try and break that up. If you are in an office job, try and stand up every 15, 20 minutes. Okay, ideally try and do some sort of body weight exercise. You probably will look weird in the office, but that is the best way to do it. So baseline activity should be a fundamental for absolutely everyone, and you shouldn't overlook it because it is probably one of the biggest things that will improve anyone's physical health. And then the 4 pillars are split up into the following. So you've got strength, zone 2, VO2 max, and mobility. So all of these you need to do in conjunction with each other because they all work on different systems. So one of them is about building muscle mass, which is really good for your metabolism. So glucose disposal, fat utilization for energy. Zone 2 is really good for fat utilization. VO2 max allows you to have a greater heart output, and if you want to look at all the studies, it is the thing that essentially allows your body to extract as much oxygen as it can to do the activities it's doing. So a higher VO2 max, greater longevity. It's probably the biggest predictor that we have. And then mobility. There's no good in being able to do all them things if you aren't able to move around a certain joint or you don't have this certain plane of movement. So that's why they are all vital that you include them. And I will go through them each, well, step by step essentially, and I'm going to explain what it means. So first one, strength training. I think it's pretty easy to explain that. You are improving the amount of force that you can exert on something, and it will improve muscle mass. Now, like I said, this is for efficiency. So the best way to go about this one is to make sure you are doing it at least twice a week. So take a Monday and a Thursday, and you should really separate them by a few days. It allows your muscles to recover because for those who don't know, a muscle grows by having micro tears. The diet, proteins repair it, and then it grows in size and improves in function, improves in strength, and then you can go on to lift more or do more with that muscle over time. And strength training is paramount because just basic things, obviously getting up out of this chair, going up and down the stairs, lifting certain objects, they all require some form of strength, which come from the muscles. And as you get older, you tend to lose a lot more muscle mass. It's called sarcopenia. And you want to have a high amount of muscle mass going into them later years because then you've got a greater, it's like having a pension. If you've got more money in the bank, there's a good chance you're going to live longer off it because there's more to use, and same with muscle. So that is what I would advise. Strength training twice a week. Okay. And that's what the guidelines would say. But what does that mean in the gym? So if you go into the gym and you're doing 2 workouts a week, I wouldn't be looking at doing bicep curls and doing all these specific exercises. You should be doing 2 full body workouts. And the aim should be that you do 10 sets per muscle group. So what a set is essentially, I'm going to use a bicep curl as an example. So if I do this 8 times, that is 8 reps, and then one of them sets. I can't explain the word set by using a set, but a collection of 8 reps is 1 set. So you should be doing 10 collections of reps per muscle group. So that could be per your legs, per your back, per your chest, per your shoulders. You need to pick big muscle groups. So like I said, you've got your legs, you've got your back, you've got your chest, your shoulders. And then when you are doing all these big movements, you will incorporate all the other accessory muscles within them. So use 10 sets per muscle group. So let's pick the legs. So you do a squat, you are incorporating your quadriceps, your hamstrings, your calves, your glutes. You're incorporating all that component or them components of your leg muscles. If you do 10 sets of them, you need to know how many reps you are doing per set. So The amount of reps you are doing is going to be individualized to you. So years ago, we would say 8 to 10, whereas now we want you to keep going until you can, if you were asked to do 1 to 3 more reps, that is what we would like you to stop on. So let's say I pick a weight to do a squat, I do 60 kilos, I do 10 reps, and I go, if there was a gun to my head, I could probably do another 1 to 3 reps. That's about perfect. And that's why it's all got to be individualized to you, because obviously you're going to be able to lift different weights. And this guideline did actually say go up to 30 reps. I personally wouldn't go above 12 reps, because at that point, I think the weight is too light to really build meaningful muscle. And you don't want to go below 6, because the weight could be too heavy for the beginning anyway, that you are leading to injuries. And that is the biggest thing that you need to make sure you are staying clear of throughout this whole process, is make sure you are able to move each day injury free. So yeah, strength, it's a bit of an awkward one to describe, but 10 sets per muscle group. And in each set, you need to have at least 1 or 3 reps in reserve, it's called. So you're not going to full failure. So that allows you to recover to some extent. It keeps you injury free for a bit longer, I suppose, from a beginner point of view. So that's what you would do for strength training. The next one is zone 2. So I mentioned this so many times. It was not something I consciously did as a part of my training, probably until the last 6 months, maybe. So it used to be called fat burning training within the 90s and noughties, when everyone basically brought out a DVD with some sweatbands around the wrists. And essentially what it is doing is it keeps your heart rate within, it's about 60 to 70% of your maximum heart rate. And what it does at this level is it's using fat as the main energy source for your activity. And why that's beneficial for you is that if you use fat, it means less of it's being stored within your skin or within organs, and it allows your body to become more efficient in these little powerhouses called the mitochondria. So if you are able to utilize fat to a greater extent in the mitochondria, your body can perform these activities to a higher standard, a higher performance level. Because, a bit of an overview, whilst I'm sitting here now, up until me doing an activity where I can't really talk whilst I'm doing it, my body wants to use fat. So if I improve my performance, then obviously fat gets used for a lot longer and less of it's being stored. It then keeps me more metabolically active, which means that I have less insulin resistance and my body is just in a better state of energy utilization. I think that's the best way to explain it before I go too much into it. Ways in which you can find out whether you're in zone 2. So like I said, the first one is using a fancy heart rate monitor. I don't use that. I use something called a talk test or a breathing test. Again, they become a bit more complex depending on the environment you're in. So when I'm in the gym, I don't do the talk test because I look like an absolute weirdo. But the idea being that if I'm doing a cycle, for example, so the exercises you can do are walking on a stepper, a brisk walk, a light jog, a row, skiing, cycling. I always pick cycling because it's easy for me to repeat the same amount of power and the same conditions. So if I go onto the spin bike and I start cycling and I can still speak, not this comfortable, but to the point where I would like you to speak a bit more in the conversation, then that is the perfect range for me to be in. So that is the top end of zone 2. If I don't want to speak, like I didn't want to do it yesterday, then I just do a breathing test where I should be able to breathe just through my nose. And if it gets to the point where the mouth needs to be used, then that is the top end of zone 2. If I start mouth breathing, then that becomes zone 3. So you want to be at the very end, very top of that zone 2, because that is where fat's being used. How long should you do it for? Ideally 150 minutes a week. And that can be split up into 5 30 minutes. It can be 150 minutes. It all depends on how you're able to do it. Now, I don't respect. What is the thing I was going to say? I acknowledge that some people who aren't going to be able to do that straight away, because one, it can be quite boring. Two, it's just a lot of time to take out of your day, especially if you've got to do all these other components. And these are all in combination with each other. So you've still got to do strength training at least twice a week. So when you're adding these in, your training session becomes longer, or you've got to go to the gym multiple times a day, which can be quite difficult. So 60 minutes a week is the minimum where you would start to see a good return on investment for your time. And I think that's where I would start with a lot of people is pick an activity that you can do at least 60 minutes a week where you are able to hold zone 2. Now, the next one is VO2 Max, which is related to zone 2 in the sense that it is about aerobic capacity. But VO2 Max is where your body is, I'll explain it a bit differently actually. So VO2 Max is the maximum output that your body can do. So let's take sprinting, let's take jogging. So it's the maximum speed that you can jog at before your body can't use any more oxygen and has to use an other energy source. And why this is key is because every process, even me sitting here now talking, when you digest food, everything that you can think of uses oxygen because that is the main cofactor, or it's the main reactant within most reactions within the body. So your body being so much more efficient at using oxygen and grabbing it from the environment and able to use it under varying amounts of constraints and pressure is more beneficial to you. And there's a graph, I'm not going to put it into this, but basically there's a graph where you can look at your age and you can look at the activity that you want to do. So let's say you want to rock climb in your 50s, you may need to have a VO2 max of 35. So you can then look back at where you are now. So for me in my 30s, I can say, okay, well, actually, I need to have 35 or I'm 50. Well, I need to have 45 now because it's going to decline naturally. So you can sort of predict and plan what you need to have. Again, everything is going to decline. We are not designed to live forever. So the more you have in reserve and the more you've got banked up now, it gives you a more comfortable life later on, essentially. So the way in which you train VO2 max, because it's pushing your body to the limits, you need to train it at its limits or near to, because if you'd done it at its limits, you would probably only do like a sprint. 100-meter sprint is at your full limit, isn't it? So it's not the exact same, the exact same thing. So the ways in which you can do this, there are the two ways. The actual proper way is called the Norwegian method. So essentially, you pick an activity where you are doing it to 95% of your maximal output because you need to hold this for 4 minutes. So let's take a jog. You need to run at a pace where you are going to be really tired at the end of that 4 minutes and you couldn't really do too much more. You do the 4 minute jog, you then recover for 4 minutes, and then you do that whole thing 3 more times. So it's 4 sets of it, 4 rounds of that, and you do a little bit of a warm up and you do a cool down. And that's known as the Norwegian method. And the actual data, I think, is that they've repeated it 3 times a week for about 8 to 12 weeks, and their VO2 max improved by about 10%. I'm saying try and do it once a week. I know that is very, very strict. So what I'm trying to say, or the best other way to do it, is by doing a HIIT class, because there will be periods in there where you are doing, so there's a class that I do in the gym called endurance, where we do a 5 minute station, and it's near enough 90, probably 95% of where I would be in terms of my effort. So that is a perfect class for me because we do so many stations. It also keeps me engaged. It stops it being boring. And that's the thing, obviously, what is optimal and efficient versus what is actually manageable and what is something that you can sustain. They're the biggest things. There's no good in doing training like this for 10 weeks and then going back to not doing anything at all. Obviously, take this with a pinch of salt. This is what ideally you should eventually work up to and surpass. But you should always try and do it where you can still do this on a daily basis, essentially. So that's VO2 max. The last one, nice and easy, mobility. Something that I struggle with, I've got better at. There's no real guideline on mobility. Ideally, you should be able to do it every day, 10 minutes a day, and that involves mobility or yoga. And why mobility and yoga are so good is that when you think about going to a gym, so I always say, think about doing a bench press. I may be able to lift 140 kilos vertical above my chest. However, if I deviate that by a few degrees, then the shoulder joints put under a bit of pressure. I may be compromised. I may not be able to move it. I injure myself. Whereas mobility and yoga, they basically improve the range of movement, if I can speak. So it prevents injury a lot better. And you usually do this with body weight or very, very low loads. And the whole point is to increase that movement around the joint. A lot of people, so myself included, one thing that I suffer from is hip tightness. And this is obviously because I am mainly and largely sat down for the majority of the day doing the desk job and doing other things with regards to the business. So my muscles are continually contracted here, pulling me further forward. I've obviously lost the ability to speak for like the last 5 minutes of this podcast. But if you are constantly in this like tight position when you come to do normal activities, you walk, it's obviously going to be contracted. You need to find a way to then alleviate these issues. I always try and do twice a week, and I feel like that is reasonable for everyone because I am conscious of the fact that I have given a lot of things that you should be doing. But at the end of the day, for me to do 10 minutes of this, 150 minutes of zone 2 a week, so many sets of strength training with one session of VO2 Max to try and keep me out of a hospital and away from medication in the future is an easy trade for me, I'll be honest. But yeah, mobility twice a week. If you can do it every day, that is the ideal. And I think the best time to do it really is after long periods of being sedentary. So a lot of people do morning mobility, obviously being in bed for 8 hours. A lot of people do it post work because they've been sat down for 7 to 9 hours or even longer if they've got a more strenuous job. So there's a lot of things that you can do. But like I said at the very beginning, this is just an efficient way. Optimal ways. So in terms of me, I strength train, how many times a week would I say? Probably 4. I do mobility twice, I do VO2 Max once, and I do my zone 2 150. Well, actually, I've been managing about 100, 130, 150 minutes of zone 2 a week. So I'm hitting every single one of these. The one that I've struggled with, but I have improved greatly over the last 2 weeks because the weather, is the basal activity. So I have been doing probably about an hour and a half walking, but I'm still finding it a big, it's very difficult for me to just get up in between patients and try and even just do, I don't know, a squat or press ups, whatever it is. It's quite hard to do that. So that is the one thing I need to improve. But hopefully, listening to this podcast, you find that physical education within the West is very poor, and that is across all forms. That is across degrees where you're paying thousands of pounds a year, £9,000 I paid a year plus any grants that were given to me to literally do 30 minutes from someone who's ideally never been in a gym. And then we do it all the way down to schools. We're not advising kids how to exercise properly. And people are largely sedentary. So this at least gives you a bit of structure. And this can be used for the majority of people, even advanced people who are listening to this now. Yes, they may be strength training 4 times a week, but I guarantee they're probably not meeting the other requirements to get a full balanced picture. For those who are active within the gym, don't get me wrong, this is quite a hard thing to go through because you're not going to be a master of anything. So obviously years ago when I first started, I was really good at aerobic training because I used to play footy. And then going into strength, I wasn't the strongest in the gym. I got to a point where I was probably in the top few people in the gym in terms of strength. But now because I've started to include a lot of other training, so more aerobic again, that strength hasn't stayed at the point where I would be happy with. So you do have to get into your head from a mental point of view that you aren't going to be your best in every single area. However, you will feel 10 times better. And if you are a health professional listening to this and you think, you know what, this is the type of advice that I should be giving to patients, it definitely is. And I'll have to do a case study. My next podcast was going to be peptides, but I'm going to do a case study on 2 family members who've had a consultation recently. One as recent as today, where the professional was basically giving us health advice and no lifestyle advice was mentioned. The person giving the consultation was close to being obese. And you think, how can these people be so far behind the actual evidence-based practices that they should be implementing every single day, and why not focus on the basics as opposed to looking at some minute detail or some radical treatment which has worked in maybe 0.7% of the population? Why not look at something that's worked in near enough every person that's ever tried exercises? It's been highly effective, and I always say that if it was bottled up as a drug, it would be the most expensive drug on the market and it'd be the best by far. As with all my podcasts, it's for informational purposes only. I've got to put a disclaimer in here just in case anyone takes the advice and goes and harms themselves. But I do more than this and it is highly effective. So hopefully you do take something away from it. If you've got this far, thanks for listening. If there's any comments or anything to do with future episodes, by all means let me know, and I will see you in the next one.